It's not the kind of thing you expect to hear inside the Western States Burn Center at North Colorado Medical Center.
I'm the least professional person you'll meet here, so.
But John Sperle's dose of reality is just what many patients need. Every Tuesday, this volunteer makes the rounds, doling out his personal prescription.
But I try to impress on them that not to get their head screwed up and make bad days out of the good days, Survive the bad days and appreciate the good days, and gradually things will come around.
John experienced plenty of bad days after being severely burned on more than 40% of his body.
Well, it was September 2006, and we were headed for Moab, Utah, actually, to do some off-road jeeping with my son and daughter-in-law who live in Grand Junction. On the way there, we were on top of Trail Ridge Road in Rocky Mountain National Park, and our Jeep caught on fire.
John says he doesn't know how he stayed positive through the surgeries and skin grafts, but he did, even learning to appreciate the intense physical therapy.
And I called it tag team therapy because you were so weak and so tired, and you just get back in bed and think, oh my God, that's over. And the next therapist or group of therapists would come in and drag you back out of bed and that. And I wasn't a big believer in physical therapy, never been involved in it. And it didn't seem to me like they were doing enough. But then I became a real believer in it because all of a sudden one day, you could do something you couldn't do 2 days before. Like walk and, some important things like that,
And John has embraced being a burn survivor.
Rebecca Garber's voice was among the first John remembers hearing from his hospital bed. Now, 6 years later, he's grateful to visit with the nurse practitioner and the staff who treat 150 patients like him every year.
They really, and I don't know how they do it, but they really take a personal interest in the patients and doing their jobs,
What keeps me coming back every day is knowing that I might be able to make a difference and my team can make a difference in making somebody feel better and get well faster. And I know that we provide excellent patient care and we have good patient outcomes. It's very rewarding. It's the team that motivates me.
John's motivation is wanting to give back to the center that gave him so much by helping other patients.
And I think sometimes they're a little more comfortable asking questions of me than they are a professional medical person. Like, what was it really like,
I accidentally thought I was putting water on a smoker, on the chips of a smoker, and blocked out what kind of container I was taking the liquid out of, and it was gas.
And I've talked to little kids and their mothers, and old people, and like me, myself, And I always tell them, well, heck, if an old guy like me can survive that, you can too, but it's up to you, You're the boss. You got a lot of help, but you're still a boss of what you do with it.